Hello, this is Dr. Grande. Today's question is dissociative identity disorder real? Dissociative identity disorder is also known as DID. And in 1994, that's when that name was given. Before that, it was multiple personality disorder. So the disorder in one form or another has been around for many years, and so has the controversy over whether DID exists or not. So there are a few different schools of thought here, but let's first start with the concept of dissociation. So we have this disorder, DID. There's also a disorder called depersonalization, derealization disorder, and another disorder called dissociative amnesia. There is not a lot of controversy about dissociative amnesia or depersonalization, derealization disorder. Most clinicians believe these exist more or less the way they're stated in the Diagnostic and Statistical Manual, the DSM. The controversy is more around dissociative identity disorder. So we could think of DID as having some similarities with the other dissociative disorders. But DID has the feature of alters, the idea of distinct personality states. And this is the area that draws the most controversy. The theory behind DID and the other dissociative disorders is that they originate because of severe childhood abuse. And that at the time of the abuse, the brain is trying to cope with the stress of the trauma, and it separates the individual from the reality. It causes dissociation. And this dissociation is protective. It helps somebody to cope with these terrible traumatic events. However, later in life, these dissociative identities can cause emotional distress as the person, as an adult, tries to contend with these different states. So there are many different theories about DID and whether it's real or not, and I'm going to break it down into three categories. So there are clinicians that absolutely believe that DID is real, and they believe the vast majority of DID diagnoses are genuine. The next category would be kind of a mixed category, where you have mental health clinicians that believe the disorder is real, but also believe that because of mental health clinicians' interest in the disorder, that clients may exhibit more of those symptoms because it's suggested by the clinicians, not directly but indirectly suggested, or that clinicians may be looking for these symptoms because they like unusual cases. This isn't unique to mental health clinicians. In most fields, an unusual case, an unusual type, is more interesting. If you like automobiles and you see an automobile that's rare, you're more likely to pay more attention to that rare automobile than a car that had tens of thousands of units manufactured. So that's that middle category. Then you have the last category, which says that DID does not exist and that it's better explained by borderline personality disorder or schizophrenia. So let's look at what the evidence is around DID. Back when we had multiple personality disorder, the idea with that disorder was that there was additional information with these personalities, with these alters. So in a sense, these alters were growing, they were developing as individuals. With DID, our understanding is that these alters are actually fragments of the original personality. No new information is really being added. Rather, each alter represents a part of that personality. I think that the change from multiple personality disorder over to DID resonated with a lot of mental health clinicians and probably moved a lot of clinicians from that last category of saying it's not real into the middle category, and from the middle category into that first category where they agree that most of the diagnoses are legitimate. Still, I can understand why there's skepticism around this disorder. It makes sense that mental health clinicians may be more interested in a disorder like this, and that may lead to more presentations that line up with the criteria of DID. It doesn't help that this disorder has been sensationalized in the media, in movies and television. So what does the evidence tell us? Well, we have different brain studies that show that the brain behaves differently in people that have DID than don't have it. There's been a lot of support over the years of clinical presentations that show that DID does exist. However, as I mentioned, I still understand there's skepticism, and I fall into that middle category. I believe that dissociative identity disorder is a real disorder. It's a distinct construct that should be a separate diagnosis, but that it's overdiagnosed. That it would be fairly easy for a clinician to diagnose this disorder when it's not really there, when it is borderline personality disorder, or it is schizophrenia, or it's something else. Perhaps dissociative amnesia, or the depersonalization derealization disorder, but not necessarily always DID. I think when you have an unusual disorder like this, where the case hasn't necessarily been 100% made, I can understand a healthy degree of skepticism. And in terms of the category where those clinicians that believe it's not real at all, I'm not there, and I'm certainly not in the category where I believe 100% of the diagnosis or the vast majority are real. But I can definitely see it as a real disorder. I've seen this disorder before. It does seem to line up with the criteria in the DSM. I've also seen instances where it was clear that somebody was trying to portray having the disorder, and it wasn't real. So, like most work in mental health treatment, a healthy degree of skepticism is good. We need to be careful and diagnose accurately. As for the treatment of DID, there are a lot of different theories around how it's treated. One popular theory is to try to fuse these fragments, these personality fragments, into one personality. This can be done with cognitive behavioral therapy and a few other treatments. Most people that undergo treatment for DID do experience a decrease in symptoms and an increase in their functioning. I hope you found this description of the DID controversy to be interesting. Thanks for watching.